All right, next slide, Hazel, because I want to make sure I get to the actual important part. A couple of weeks ago, we realized that not everybody who comes to these seminars actually knows what a recovery community center is and really has a good feel, has had a chance to interact personally and understand what you all contribute to this. So we have decided to do this live feature where we invite a recovery community center to come here and speak about the work what you do at your center. And our guest today is OCARTA, and we have with us today Donna Woods, Timothie Smith, and Brandi Vore from the Oklahoma Citizens Advocates for Recovery and Transformation Association. And they will give us a quick tour of who they are and what they do. Take it away.
My name is Donna Woods. I'm the executive director and founder of OCARTA. And I think I'm supposed to kind of let you know, how it began. I was running a 54-bed treatment facility in Oklahoma City. And I realized that once those individuals from that 9-month to year residential program left, they fell off because there was no place else in the community to go. So we began as an advocacy agency, therefore our name, and began to fight for those rights for those individuals struggling with addictions and mental illness in the state of Oklahoma. We were the only one basically fighting for those individuals with addictions because there were a lot of other different mental health organizations that advocated for that. I soon realized that it was not just enough to advocate for these individuals and make sure that the treatment doors stayed open and perhaps expanded, but we needed someplace in the community where they could meet, they could be in a safe environment, that they just didn't have that hour or two a day for self-help groups, etc. Therefore, I began with a SAMHSA grant. We started Sister to Sister 4-year program. We had 600 women, over 200 children. And by combining that authentic voice, which is that peer voice, along with making sure that they made their appointments, clinicians, no enabling. I will say that program started in 2006, and in 2021, those first individuals are still in recovery. So 87% of those women and children are still in recovery today, 20 years later. And that is the miracle of an RCO or RCC, is that we come together with them to trust the bills. We do all sorts of living skills, I'm trying to rush here. So our program is all about breaking down those barriers so that we can stop the recidivism and relapse back into those systems of care. And by looking at each individual holistically, not just about their recovery, but everything else that keeps them in the community and build on recovery capital. Right. Mr. Tim Smith.
Hi, everyone. My name is Timothie Smith. I'm the program manager for OCARTA in Oklahoma City. I'm also a person in long-term recovery. I kind of want to speak to how a participant would feel when they walk into our organization. So when they walk in, we always work under the 8 dimensions of wellness. We want to focus on what their highest needs are. And of course, we also try as hard as we can to work under a housing first model. So having that said, we also, one of our main contracts with the state of Oklahoma's Department of Mental Health is our peer recovery drop-in center. So what that means is basically we're providing a safe space for people to come in and speak about their recovery, speak about their trauma, speak about anything that they need our help with in terms of our services. And also, so providing a safe space also means that, we're taking DEI and LGBTQ2 matters into all of our programming and all of our services we're providing. So we are trying as hard as we can in every aspect of our organization to make sure that our organization is remaining a safe space for everyone to come into. Like I said, so when someone walks in the door to OCARTA, we're assessing those needs based on the 8 dimensions of wellness. We're going to intake them into our system and then do what's called a recovery management plan. That's a lot like a treatment plan, but in the peer modality, it'd be a recovery management plan through RDP. We're right then and there, we're going to assess their needs up top. Is it housing? Is it employment? Is it a substance use disorder? Is it severe mental illness? And then kind of mitigate all of those factors in the moment with our recovery coaches and our recovery staff here. So that's about it for our programming. We're going to go ahead and turn it over to Obana.
Hi, I'm Obana. I am a peer recovery support specialist. I am certified. And the big thing about being a recovery support specialist is the fact that you are working on an equal footing with the people who have come to you. There is an emotional understanding and an emotional safety that comes from having lived experience of what they're going through. There is something about talking to someone who's not only been there, but has survived it and more importantly, thrived from it, that makes it comforting to know that there is hope. There is something after mental illness. There is something after addiction. And there are so many people who have said to me in the course of mentoring and peer support groups and so on, that they smile and they say, oh, so you understand. That feeling of understanding only comes from talking to someone who has lived through it and made something out of it. And I marvel every day that the thing where I was at my weakest point has become my greatest strength. And I'm able to share that. And I've done more than survive. I'm thriving, I'm loving life, and there's nothing better than for me than to be helping other people through their path to recovery. Because everybody's path is different, but there is a certain necessity of someone really knowing what you're going through. And that's everything to me.
And so that's just a little bit and a small synopsis about what we do. You know, we'll open it up to any questions. I'm so grateful to be here. What an honor. And we hope we can share something that can help you on your path.
So thank you so much, OCARTA, for being here and telling us about your work and what you do. I'm sure what you said resonates with so many of us on so many levels.